And I'd like to introduce the first of those speakers, Dr. Keith Fargo. So Keith is the scientific director of programs and outreach at the Alzheimer's Association, which is based out of Chicago. We're very fortunate to have him here visiting us today. He leads research programs and initiatives that are helping to accelerate that association's vision of a world without Alzheimer's. And his team helps to organize a very important meeting, which is coming up, I think, in a month, which is an international conference. It's the largest and most influential international annual meeting dedicated to advancing dementia science. And Dr. Fargo also oversees the data that's reported in the Association of Alzheimer's Disease Facts and Figures, a publication that has had enormous influence on not only scientists, but also policymakers and governments around the world, and the investments that they understand that they need to make in dementia. It's had an extremely important impact in the United States on investment in that area. So I want to welcome Dr. Fargo, and I very much look forward to your presentation.
Hi, good morning, everybody. Can you hear me okay? Everybody in the back? All right, very good. Well, thanks for having me here. I want to thank all of you for welcoming me warmly this morning. I'm excited to be here and just talk to everybody a little bit about, kind of just a top level, sort of view of some of what's happening in Alzheimer's disease and dementia research today. And necessarily, it's going to be fairly short. I've heard that there are no fewer than 3 people who are going to start holding up cards telling me I only have 5 minutes left and 1 minute left. So I'll try to be brief. Just by way of introduction, the Alzheimer's Association is a global organization, and we are really focused on 2 primary goals. And the first, and that's represented by our mission symbol here. And people ask me what that squiggly line is, and so I thought this graphic might help people. So on the left-hand side there, you see that's representative of a human head, and that represents the part of our mission that is enhancing care and support for people who have Alzheimer's disease and other dementias today, helping people live the best lives possible who currently have the disease, while simultaneously working to eradicate Alzheimer's disease, which is represented by the other half of the symbol, which is on the right that you see there. And that represents the science side of what we do, and so that is a scientific beaker. Now, for the scientists in the room, I know you want to correct me and let me know that that's a Florence flask, and that's true, that is a Florence flask, not a beaker, but for the other 95% of the people here, they're going to think it's a beaker. So we're going to go with beaker. So just to kind of set the table here as well, I know we have members of the public here. There's a lot of confusion generally between the terms dementia, Alzheimer's disease, and other causes of dementia. So just to briefly set the table, dementia is really a set of symptoms. It's what a person who has one of these brain conditions experiences. And it means that they have lost cognitive ability. Usually we're talking about memory, but also judgment, decision-making, orientation to time and place, etc. When they lose those cognitive abilities to the point that it begins to interfere with their daily living, their activities of daily living, that's dementia. So having trouble dressing yourself, feeding yourself, getting lost on the way home from the grocery store, etc. Now, I want to say here, because age is the greatest risk factor, that is absolutely true, and as the population ages, we do have an enormous task ahead of us. But Alzheimer's disease and other dementias are not normal aging. And if I can ask you to remember one thing from today, it's that. This is not normal aging. Now, all of us, virtually all of us, are experiencing something called normal age-related cognitive decline. Most of you in this room who are over the age of 30 have probably begun to experience this, where it gets progressively more difficult to remember names and faces. You walk out of the grocery store, you may not remember where you parked your car, so you have to use a little chirp chirp thing to find it, right? We've all experienced that. That is normal, but dementia is not. Dementia is an indication that there's something more serious happening in the brain that is causing that cognitive loss. And these are just a few of those things. Most people who have dementia have it because they have Alzheimer's disease in the brain. So Alzheimer's is a specific set of brain changes that we'll discuss briefly. Some people have dementia because they have vascular pathology in the brain. Others have Lewy body conditions, including Parkinson's disease. And frankly, we have to be fair and say that most people who are of the age to develop dementia today likely have more than one of these pathologies happening in the brain. So we like to put them in these neat little buckets, but for most people who have dementia today, you're probably dealing with at least a little bit of more than one of these causes of dementia. I also want to point out that even though we go publicly by the Alzheimer's Association, our legal name, if you will, is the Alzheimer's Disease and Related Disorders Association, the ADRDA, which means that we are working in care and support and research for all of these causes of dementia, not just Alzheimer's. But I will focus primarily on Alzheimer's disease today. So these two folks here are August Dieter and Alois Alzheimer, and it's because of them that, well, yes, because of them, this is called Alzheimer's disease. I was about to take that back and say, really, it's because of the scientists who were working in that time, but that includes Dr. Alzheimer, and they were living in a time of scientific revolution. And the revolution at that time was better microscopes and better staining techniques. So people have had Alzheimer's disease since time immemorial, but it wasn't called Alzheimer's disease until the right kinds of microscopes and staining techniques were invented, so that August Dieter, who was the first person described to have Alzheimer's disease, when she passed away, her physician was able to take her brain out on autopsy, look under the microscope with these new staining techniques, and what he saw today really are still the three primary hallmarks of Alzheimer's disease. He saw amyloid plaques, tau tangles, and neurodegeneration. Now, the neurodegeneration you can actually see with the naked eye. You don't need special staining techniques for that. And you can also see it on MRI now, although by the time you can see it on MRI, a significant amount of brain damage has already occurred. And as you all know, you want to catch and treat diseases as early as possible in the disease process. You don't want to wait until the shrinkages of the brain is visible on MRI. But for decades, this happened in 1906, by the way, so for decades and decades and decades, we didn't know much more than this, to be frank. Alzheimer's research didn't really pick up until the early 1980s. It was when we started to see more significant investments in Alzheimer's research. So I want you to imagine with me, if you will, that your job is highway safety officer, and your job is to prevent automobile accidents on the highway. But they only ever call you to the accident after the accident has occurred. And so you can look at the tire tracks, you can see maybe bent guardrails, you can see mangled cars, you can see broken glass glittering in the sun strewn across the highway. And from these hints, from these clues, you can begin to put a picture together of what you think might have happened and what the order of those events were that led to that accident. But you can't really be sure. You're making an educated guess. So wouldn't you rather have a video camera and be able to see these things unfold in real time? I know I would, and I know most Alzheimer's researchers would, but for decades and decades, we were living without that until the advent of what I'll call biomarkers, and we'll talk a little bit more about that coming up. But this is where things stood for a long time. Now, there are some therapies that are available for Alzheimer's disease today, but none of them are what we would call disease-modifying. All of them are symptomatic, meaning that they can help support cognition for a period of time, but they're not doing anything at all about the underlying amyloid plaques, tau tangles, or neurodegeneration. The entire time that you take these medications, the plaques, tangles, and neurodegeneration continue absolutely unabated. And so what researchers are looking for today are these new disease-modifying medications that would either slow the progress of the underlying brain disease, or better yet, halt the progress of the underlying brain disease. And you can potentially do that, by the way, before symptom number one ever sets in. And that's what we're talking about when we're talking about eradicating Alzheimer's disease, finding people who are on the road to develop Alzheimer's disease, but treating them with a medication that stops that from occurring. So our role at the Alzheimer's Association is multifold in this fight, and as I mentioned earlier, it's a global fight, and this is obviously something that we're dealing with all across the world, and we're happy to be part of that global response to Alzheimer's disease. I can't tell you, obviously, in limited time about all of these research programs, but I'll point out two in particular. If you look at the top left and then sort of one in, you'll see something called GAIN. That is the Global Alzheimer's Association Interactive Network. And what GAIN is a collection of research data on almost 500,000 people that is publicly available through the Alzheimer's Association for researchers anywhere in the world to download, analyze, publish on, etc. So big data obviously is one of the next most important frontiers, and we're happy to be able to make that kind of big data available to the scientific community to work on free of charge. I will also draw your attention to the International Research Grant Program, which you see sort of underneath, sort of furthest to the left and one down here. Over the years, we've been able to fund hundreds of millions of dollars in research grants in 32 different countries, of course, including Canada, and including, as a matter of fact, some researchers right here at Toronto Rehab Institute, which we're happy to be able to do. Now, one of the grants that we gave fairly early on actually has begun a new scientific revolution. And in this room, you may not know this. The dementia researchers do, but the rest of you may not. You are now living in a new scientific revolution as it relates to Alzheimer's disease research. And that revolution is the biomarker revolution. All right, I hope it's nothing serious. So that was just an underlined biomarker revolution. Womp, womp. All right. So what you see here on the top, this is a human brain during life of a person who's aging normally. And what you see on the bottom, this is a human brain during life of a person with Alzheimer's disease. And what you're seeing here are amyloid plaques during life. Now, this was, again, funded by an Alzheimer's Association research grant that we're very proud of and happy to have been able to make. And this has really created a sea change in how researchers today understand this disease and how they're able to approach this disease. So you're seeing the amyloid plaques here again on the bottom. Now, this has been available for about 16 years and has driven a lot of what you've seen in the development of research in Alzheimer's over time, the focus on amyloid in particular, even for clinical trials, because you can now see that during life and get the right people into those clinical trials and know, by the way, if your amyloid targeting medication is actually having the effect that you desire it to have. Now, more recently, researchers have discovered tau imaging as well. So that's about 6 years old. And then even more recently than that, researchers have discovered the ability to image the very earliest stages of neurodegeneration, long before the degeneration becomes visible on MRI. And so now you have a situation where all three primary hallmarks of Alzheimer's disease are now visible during life. So gone are the days that you didn't know who had Alzheimer's disease. Gone are the days that we didn't know what happened first, amyloid or tau or neurodegeneration. Gone are the days that we didn't understand the timeline of these events and when amyloid began to build up in the brain, when tau tangles began to build up in the brain, et cetera. And this has really changed how we understand the disease as a research community. And so what you see here along the top is this is a person's cognition, a person who has or is developing Alzheimer's, going from cognitively unimpaired, right, so having disease but not having any symptoms yet, all the way to dementia on the right-hand side. And what you see in that graph on the right here is sort of normal cognitive aging in the solid line, and then a person's cognitive trajectory if they're developing Alzheimer's disease in that broken line. And we now know there's a long preclinical phase, or a silent phase, if you will, of Alzheimer's disease. And then a person develops something called mild cognitive impairment, which is serious cognitive impairment, but not yet interfering with activities of daily living. And then once that does begin to interfere with activities of daily living, then that's called dementia, like we talked about. Well, in the old days, researchers had to rely on medical history, family history, testing of cognition, et cetera, to find people who have Alzheimer's disease. And so all of the research in Alzheimer's disease was focused way over there on the right-hand side, including the clinical trials. So we were doing clinical trials on people who already had a significant amount of brain damage, and quite frankly, we weren't even sure that it was due to Alzheimer's. Many of these cases, it turns out, were vascular disease, Lewy body disease, et cetera. And you can imagine what that does to your ability to develop disease-modifying medications when a lot of the people in the trial don't even have the disease that you're studying. But that's all changed, and so now researchers are able to use these biomarkers and identify people with Alzheimer's-related brain changes long before the dementia symptoms set in. And we now know that there is a 20-year period, 20-year window of opportunity, a 20-year window of hope in which we may be able to intervene in Alzheimer's and stop the dementia from occurring at all, as long as we can develop disease-modifying medications against Alzheimer's. And so a lot of the research that's happening now is in that preclinical phase. Now, I mentioned MCI, mild cognitive impairment, and I did that specifically because this next slide makes reference to that. Now, I mentioned that we're not focused solely on Alzheimer's disease, and one of the other common causes of Alzheimer's is vascular dementia. Well, we just saw reported earlier this year the results of a clinical trial of blood pressure medications. This was called the Sprint Mind study. More than 9,000 people who had high blood pressure. And the randomization in this study was, are we going to treat people to get their systolic blood pressure down to 140, which was the old standard, or to get their systolic blood pressure down to 120, so a more aggressive blood pressure treatment. No new experimental medications, only using the medications that were currently available on the market, many of them generically, so very low cost kind of intervention. It's just getting the dose right to get people down to 120 instead of 140. And in fact, what happened, we followed these people for 7 years, and what you see is that there's a 20%, almost 20% reduction in a person's risk for developing mild cognitive impairment. And then when you add into that the combined risk of mild cognitive impairment and dementia, it was 15%. Now, I think that's just because the study hasn't gone on long enough, because frankly, just logically, if you don't develop MCI, you don't develop dementia. You have to develop dementia or MCI first. So we're now continuing to follow those people further along to see if the same reduction would be found for dementia as is found for MCI. Now, I wish this had been 100%, okay? But it's not. But I'll take 20%. When you look at the numbers that Dr. Waters was telling you earlier in terms of the global prevalence of Alzheimer's and other dementias, 20% is still an enormous number of people across the globe. So you take those two things together, this new biomarker revolution that's allowing us to target Alzheimer's disease even before symptoms set in, and now what we're learning about treating blood pressure medications and other cardiovascular risk factors to reduce the risk for dementia, largely driven probably by vascular dementia, but there may be an effect on Alzheimer's as well. We're now living in an age really where prevention is possible. Okay? At least we have research studies in that direction. And so you'll see a few of them here. Now, I'm being told I only have 3 minutes left. So I'll just briefly point out a couple of these. The A4 study is on the top right there. This is a study of people who have high levels of amyloid in the brain but don't yet have dementia symptoms. And they're being treated with a medication that is designed to reduce their amyloid levels, okay, to see if you can then delay or potentially completely prevent them from developing dementia symptoms. The worldwide fingers, this is a study down at the bottom left. This is an Alzheimer's. Oh, by the way, we've funded the A4 study. It's a public-private partnership. We've put about $8 million into that. The worldwide fingers study is a consortium of studies that are actually happening all across the globe, including the United States. We're currently in negotiations with Canada for a version of this in Canada as well. The one that we're doing in the United States is called the U.S. Pointer Trial, and this is a multidimensional lifestyle intervention study. So reducing blood pressure, but also layering in on top of that exercise, diet, cognitive stimulation, social stimulation, to see if we can push that 20% up to 25%, 30%, maybe even 35% reduction in cases. And so that would be terrific, and we just started that earlier this year, and we hope to have results from it in the coming couple of years. But of course, as we work to eradicate the diseases, I mentioned earlier, we're not focused solely on that. We do have a strong interest, an acute interest, in making sure that people who have Alzheimer's and other dementias today are able to live well, live the best lives that they can. And so over time, we have released a number of guidelines for quality care to help people live that best life possible, going back really to the 1980s with our earliest guidelines for dignity, and then moving up through key elements of dementia care practice recommendations for nursing homes, et cetera. And then most recently, we've actually, in 2018, we published our newest evidence-based recommendations as a supplement to the gerontologist. And so anybody working in dementia care here, I would urge you to go take a look at those. Now, there's supposed to be text in that box on the left-hand side. For whatever reason, it didn't make it through from my computer to this computer, but just pretend like there's text there and we'll be okay. Now, of course, I know that the Toronto Rehab Institute is focused on this as well, and I think we're lucky to have such great researchers here for, as a group, as the world, we're lucky to have this happening here. And the Alzheimer's Association obviously feels that way as well, because over the years we have funded a number of researchers who either have been at the Toronto Rehab Institute or currently still are, many of them focused on some of those exact questions about living well with Alzheimer's disease and other dementias, and I know we'll have a chance to hear from Dr. Iaboni in a few minutes. All right, now I think Mark is going to introduce the next speaker. Thank you all very much.